Visual problems are not necessarily visual problems. So even though you feel like it's in your eyes or you're not able to focus on something and you feel that it's an ocular motor problem, it may be, but it also may not be, because the way that your brain works is that it integrates input from a number of systems to help things function properly. So stuff that might look like a visual problem also requires input of the vestibular system. So if there's a vestibular problem, sometimes your eyes can flicker because of that, and it makes you feel dizzy and off and you can't focus or you can't zero in on a particular target. That might be a vestibular issue. I had a patient yesterday who came in complaining of dizziness. Initially when we were talking, I thought, this is likely to be kind of a neck related issue, but he also described some symptoms that could be representative of BPPV, which is a vestibular vertigo type of thing. And when I put him in the position to test for BPPV, his eyes just started going nuts, like haywire nuts, moving all over the place. And he had to grab onto the table and he was screaming, believing that he was flipping backwards, right? Because that's the sensation that he was getting. But his eyes were going all over the place because the input of your eyes and your eye motion is heavily influenced by your vestibular system. So what you think might be a problem with your eyes might be actually a problem with your vestibular system. So it's important to take a look at that as well. It could also be input from your proprioceptive systems. So your proprioceptive systems are the sensors in the muscles and joints throughout your body, right? The thing that I always say to my patients is like, I don't have to look at my arm to know that my arm is straight out and extended. Why? Because the sensors in my skin cells, the sensors in my joints, the sensors in my muscles tell me the position that my arm is in. Same if I bend it, if I straighten it, I know where I am in space because that's all that input is from my proprioceptive system. The highest density of proprioceptive fibers are in your digits, in your fingers, to be able to be very dexterous and move very well to grab things and whatnot. The next highest is in your neck. And your neck tells your brain a lot about where you are in space. So as your eyes move to the right, the muscles that are designed to also turn your head to the right engage in preparation to go that direction, because the way that we're set up biologically from a safety perspective is that if there's a predator, there's a tiger to my right, I'm going to look and turn at the same time. So everything in your body is set up to go that direction. Now, all of these things, so your visual system, your vestibular system, and your proprioceptive system from your neck, go through your cerebellum, and that's what integrates the coordination of movement. So if somebody has a cerebellar issue and they try to reach for something, they will not be able to do it because the integration of their eyes to see the target and the sensors of their muscles are telling their cerebellum different things, and it ends up in this jerky movement. You don't have a nice smooth movement. The same thing can happen through your eyes. So if your head is like this, and your eyes are level, and your ears are level, and the signal going through your cerebellum is that, yep, we're level, and your neck has some tension in certain areas, some damage to some of the muscles, and the sensors are giving abnormal input, well now, your cerebellum is getting the signal that your neck is heavily tilted to the left, let's say, or heavily rotated to the left. And all of a sudden that change in interpretation coming in, so you have your cerebellum goes, wait a minute, the eyes are saying this, the ears are saying this, but the neck is saying something different. I don't know who to believe. And you get that feeling of, oh, wow, that feels weird. And I will get this from patients all the time. I'm driving, car, I want to change lanes. I go to shoulder check, and all of a sudden, whoa, I get this split-second dizziness where I just feel off. To me, that is usually what turns out to be a neck issue, even though they feel it visually, or they feel it like it's a balance problem. It is technically a balance problem, but it's actually input from the neck because the proprioceptive system in the muscles and joints of your neck are the abnormal signal that you're getting. As soon as you fix that, the signals are all the same, and once the signals are the same, people feel good. They don't feel dizzy when they turn to the right or turn to the left. They feel their eyes are able to move, because if you think about even smooth pursuits, your eyes are moving across a page. Well, as your eyes are moving across a page, like I said, the muscles in your neck that are supposed to turn your head in that direction, they're engaging. You don't feel it, but they're actually engaging, ready to go so that you can turn that direction. Well, if there's abnormalities there and things aren't sitting right and those muscles are getting abnormal input because their sensors are either stretched or they're damaged or whatever, as your eyes move, that's what can create some of that skipping. So even though you might be doing vision therapy and you're doing thumb tracking, and you're seeing a vision therapist, and they're doing all this work with your eyes, and you've been going for 6 months and you're not really seeing that benefit, that's because there could be something underlying that issue that hasn't been addressed, like an issue with your neck, like an issue with your vestibular system. So the thing with concussion is we have to look at this from a global approach. We tend to segment things in healthcare. If I'm a knee specialist, I just focus on the knee, but most knee problems are from the hip or from the ankle. And that's where the whole thing falls apart. So if I'm a vision therapist, I'm going to focus on the vision, but the problem might be in the vestibular or the neck. And so it's kind of that thing where we have to work together in a kind of a multidisciplinary fashion in order to be able to get the best picture for this. So if you are receiving vision therapy and you're kind of getting to that point where you're like, I'm not really getting better here, what's going on? There's probably something underlying that no matter how much therapy you do, if the signals are mixed and crossed because something else is out of whack, you're never going to get to the point where you feel like you've had that difference has been made.